and Rachel as well.
Thank you, Mr. Chair. Ryan Woolsey with the Legislative Analyst Office. This morning, I've been asked to provide some high-level background on the CalWORKS program as context for a proposal that you'll be hearing later in the agenda. I'll be speaking from a handout entitled CalWORKS Overview that's been distributed to you. CalWORKS is California's version of the Federal Temporary Assistance for Needy Families Program, or TANF, which was created through the 1996 federal welfare reform legislation. In California state law, the goals of CalWORKS are defined as first, reducing child poverty in the state, and second, meeting the purposes of TANF, which include first, providing assistance to needy families, second, ending dependence on government benefits by promoting job preparation, work, and marriage, third, preventing and reducing the incidence of out-of-wedlock pregnancies, and fourth, encouraging two-parent families. CalWORKS works to achieve these goals by serving very low-income families with children through two primary program components, cash assistance and welfare-to-work services. On the cash assistance side, families receive a monthly cash grant, a modest cash grant that is intended to help meet basic needs. On the welfare-to-work side, in general, able-bodied adults are required to either be employed or participate in welfare-to-work activities intended to lead to employment as a condition of receiving assistance. And I'll talk about this work requirement in a little bit more detail on page 2. The work requirement consists of a set of allowable activities that are defined in both federal and state law. However, federal and state law define these activities somewhat differently. And as of January 2013, adults in the CalWORKS program are limited to 24 months, cumulative 24 months of participating in state activities. And after these 24 months are exhausted, the work requirement shifts to relatively less flexible federal activities. And if you'll take a look on page 3, you can see at the top of the page a list of some of the activities that are available under state law. This isn't a comprehensive list, but it's most of the main activities. There's things like unsubsidized employment, which would be your traditional employment, but also subsidized employment, vocational education, which could be at a community college, mental health and substance abuse treatment, or attending secondary school or a GED course. During the 24 months of participation, any of these activities will meet the requirement. But after the 24 months are exhausted, some activities continue to be available and are unrestricted, like unsubsidized or subsidized employment. Other activities continue to be available but are restricted as to duration. So vocational education is only available for 12 months instead of indefinitely as under the first 24 months. Other activities continue to be allowable but are restricted as to intensity. So, for example, a GED course would be allowable under federal rules, but only if the participant participates in an additional 20 hours in unrestricted activities on top of that. A couple other things to note about the CalWORKS program back on page 2. CalWORKS recipients are entitled to receive supportive services to enable their participation and meeting the work requirement. These include, most importantly for today's discussion, subsidized childcare, but also reimbursement for some expenses related to participation. Adults that fail to comply with the work requirement without good cause are sanctioned, which means that the family's grant is reduced by the adult portion. And additionally, regardless of whether the work requirement is applicable to a given adult, adults are generally limited to 48 months of assistance in the CalWORKS program, and at the end of that time, the family's grant is reduced by the adult portion. But it's important to note that in California, in cases of sanction and in cases of reaching the 48-month limit, children continue to be assisted with cash assistance so long as the family remains eligible. I'll finish my background on CalWORKS by mentioning 3 recent changes to the CalWORKS program that were made as part of the 2013-14 budget. Research shows that most CalWORKS families face barriers to employment. These include things like low English proficiency, learning disabilities, or poor mental health, among many others. CalWORKs has services intended to address these barriers to employment, but the 2013-14 budget included 3 new strategies, collectively known as early engagement, which are intended to more effectively identify and address barriers to employment, specifically early in a participant's time in the CalWORKs program. The first of these strategies is a new online appraisal tool which will replace existing county appraisal tools which are used to identify barriers and determine which welfare to work activities are appropriate. The new tool will be, in many cases, more comprehensive, and it will be consistent across the state. The second strategy is family stabilization, a new component of the CalWORKs program, which provides intensive case management and specialized services to families that are facing immediate and destabilizing needs like imminent homelessness or a serious unmet mental health need. Counties are currently in the very early stages of implementing this family stabilization component. And finally, the 2013-14 budget provided for funding for approximately 8,000 additional subsidized employment slots in the CalWORKs program. And with that, my colleague Carolyn Chu will discuss the child care and development system.
Good morning, Chairman Block, Chairwoman Corbett, Senators Monning and Leno. My name is Carolyn Chu from the Legislative Analyst's Office. I've been asked this morning to give you an overview of California's child care and development system. I believe the sergeants have passed out a handout to you to go over that. So who benefits from our subsidized child care and development programs? The subsidized child care and development programs are generally designed for low-income working families. Those are families making below 70% of state median income. This is about $42,000 a year for a family of 3. Parents can only receive services for the period that they're working, with the exception of the part-day state preschool program, which does not require the parents to be working. In addition, children must be under the age of 13 in order to qualify for services. Some families are guaranteed access to subsidized child care services, particularly all families participating in the CalWORKs program, as Ryan just discussed. These families that are in stage 1 and stage 2 are guaranteed child care as long as they're participating in welfare to work activities. Families in stage 3 CalWORKs are not statutorily guaranteed access to subsidized child care services, but historically the legislature has fully funded that program in order for all families to receive subsidized care. For those families who have not participated in CalWORKs or are not currently participating in CalWORKs, they are not guaranteed access to subsidized child care services, as the state does not provide sufficient funding for all of these families to access those services. Consequently, these families are prioritized for services based on their income. So the lowest income families are the first ones to receive services. Because the state doesn't provide sufficient funding for all of these families to receive services, there are significant wait lists across the state. Moving to page 2, the state provides subsidized services through a number of different programs. This chart here lists those programs as well as the estimated number of children served. As you can see, overall, the state serves around 340,000 children in the various programs. As I mentioned, the stages of the CalWORKs program are based on the relative stability of the family, and all those families have historically been guaranteed services for care. We have and for the non-CalWORKs families, we have general child care, alternative payment, and the migrant and handicap programs. I'll note that the migrant and handicap programs are limited in the families that they'll serve. The migrant program only serves those families whose income is from agricultural work, and the handicap program is only available for students that are handicapped, and it only occurs in the Bay Area. The state preschool program is both a part-day and full-day program. Approximately 3/4 of the slots provided in that program are part-day. And again, that's the program in which families do not have to be working in order to participate. They just have to be income and age eligible. Turning to page 3, families receive care in a variety of settings. Families can choose from centers and family child care homes. Both of these settings are licensed settings in which community care licensing goes out and ensures that these programs adhere to health and safety standards set by the state. We refer to these standards as the Title 22 standards. These are the minimum health and safety requirements required of these providers. License-exempt providers are family, friends, and neighbors that parents might select to care for their children during the day. These providers only have to self-certify that they meet the health and safety requirements made by the state. The state does not independently verify that they meet those requirements. The standards that the programs that the state offers must meet different standards. The CalWORKS program and the Alternative Payment Program must only meet the Title 22 standards, the health and safety standards, whereas the General Child Care and State Preschool Program must meet what we call Title V standards. The Title V standards are those standards that incorporate educational components and developmentally appropriate activities in the care. So not only do the General Child Care and State Preschool programs have to include meet the health and safety requirements, but they also must provide developmentally appropriate care. That's not to say that families who participate in the CalWORKS or Alternative Payment Program aren't receiving care that's developmentally appropriate. It's simply that the state does not require those programs to include that component to the children's care. So turning to page 4, this chart just lays out how much we spend on the programs. 2 state agencies administer our child care programs. The Department of Social Services administers CalWORKS Stage 1, and then the Department of Education administers all other programs, Stages 2 and 3, and then all of the non-CalWORKS child care programs. Funding for the child care programs is a combination of state and federal dollars. We really blend those dollars together to provide all of our programs. State funding accounts for about 60% of all funding dedicated to these programs. The total, as proposed by the governor for 2014-15, is approximately $2.1 billion if you include the $509 million in Proposition 98 funds. So turning to page 5, so given how much money we spend on these programs, how do we actually allocate the dollars? How do we pay providers? We pay providers through 2 basic mechanisms. The first is vouchers. All families that participate in the CalWORKS Child Care and Alternative Payment Program are reimbursed through vouchers. We pay vouchers based on a regionally adjusted rate. Each county has a specific rate that the state is willing to pay for that voucher. But the payments that we make to actual providers depends on the provider chosen by the family. So if the family chooses a provider that charges less than the maximum value of the voucher, the state only pays what the provider is charging. That said, if the family chooses a provider that charges more than the value of the voucher, the family must make up that difference. And then the last bullet under vouchers here just gives an example of the differences in what the voucher value can be across the state. So for full-day monthly care for a 4-year-old in Sutter County, the state is willing to pay up to $643. And in Marin County, the state is willing to pay up to $1,100. Now, the second mechanism I mentioned are contracts, where the California Department of Education contracts directly with providers in particular locations throughout the state to provide services. And the state reimburses those providers for those services based on a standard rate of reimbursement. So in every area of the state, from Kern County to Siskiyou County, it's the same rate. And that rate is $716 per month for a 4-year-old child. And again, I'll just emphasize, those are the programs that are required to include the educational component to the care, are the ones that we provide based on contracts and on a standard reimbursement rate.
The vouchers don't necessarily involve the educational component?
That's right. The state does not require that programs that are accessed through vouchers include developmentally appropriate activities. That's right.
Thanks.
So turning to page 6, the child care and development programs experienced some notable reductions during the recession. Overall funding for the programs decreased approximately $984 million. That was a combination of changes in caseload, how many children were served, as well as various changes in policy that resulted in reductions. And that resulted in approximately 110,000 slots lost throughout all of the programs. So I'll just note some of the policy changes that were made during this period, as you are all very well aware of. The state instituted work exemptions for CalWORKs participants with very young children. The maximum reimbursement rate for license exempt providers was reduced. So that's something I failed to mention. If a family chooses a license exempt provider, the state will only pay up to 60% of the voucher's value for that license exempt, for that family, friend, or neighbor provider. And whereas the state had paid up to 90%. The state maintained the regional market rate and the standard reimbursement rate at 2005 and 2007 levels respectively, so those have not been adjusted since that time. The eligibility threshold for services was lowered from 75% of state median income to 70% of state median income. Payments to administrative agencies were reduced. Quality projects that the state provides were also reduced. Fees were for the Part Day preschool program were also introduced starting in 2012-13. I'll note that prior to that, the institution of those fees, the state has fees for all other child care services. So families are required to pay a nominal amount for the services that they receive based on their income. And the institution of the state preschool program fees for the Part Day program was an effort to save slots. But I think you're going to hear more about that in your agenda later today. And lastly, some nutrition funding, additional nutrition funding for private child care centers and homes was reduced as well.
Okay, thank you. Appreciate that. I've got a question, then we'll move to the other senators for questions if they have any. The number of slots was reduced by, I think you said 110,000, which was about a quarter of the slots. Mm-hmm. Now, because there was a rise in unemployment, I would assume there was some decrease in demand because those not working wouldn't need the child care. Do we know, once that's taken into consideration, I assume the waiting list still grew. Do we know how many people were attempting to get slots but who didn't have slots available to them?
We actually do not know that because one of the budgetary savings made by the state was to eliminate the centralized eligibility lists, which was our ability to aggregate the waiting lists across programs. So we actually don't know what sort of changes to the waiting list may have occurred over the course of the recession.
Is there anything in the current budget that would restore the keeping of those kind of eligibility lists?
There is not at this time.
Okay. Thank you. Any questions from the other senators? Senator Corbett?
Do you have any thoughts on what our weaknesses in the child care system are? Maybe what some of the strengths are in California?
Well, California, compared to other states, is relatively generous in terms of what it provides in child care services, both in duration as well as income eligibility, and our quality standards, particularly for our Title V programs, are quite high compared to other states. As we'll talk about later on in your agenda, when we discuss the report that was just issued by our office, one of the major challenge that the state's child care and development system faces is that it does not leverage both choice in terms of a family's ability to choose among an array of providers and these high quality standards across its programs. Each of our programs have different policies and requirements, and we don't leverage these major strengths, choice and high standards, across all of them.
Okay, thank you.
Just a technical question. The chart on page 2, and that's page 2 of the second handout you went over, it shows a total of preschool slots at 340,000, or a total of slots, 340,000. Now, is that unduplicated, or would, for example, some of the children who are getting general child care among the 47,000 also be in state preschool?
That's a good question. These are unduplicated numbers, but from a budgetary perspective, the full day, the second half of the state preschool day, is paid for through general child care dollars. But these slot numbers are not duplicated in your chart.
All right. Thank you. Any other questions? Seeing none, I'd like to thank and excuse this panel. And with that, I'd like to mention that Senator Monning has joined us. Senator Leno has had to leave. And I will now turn over the gavel to Senator Corbett, who will chair the next item.
Thank you very much, Senator Block. And our next item is the Department of Social Services and the Parent-Child Engagement Pilot Project. I'd like to welcome the testifiers as they come forward. We have with us today Todd Bland, Deputy Director of the Welfare to Work Division, Department of Social Services, and if the rest of you would please also introduce yourselves. Thank you.
Thank you. Good morning, Chair Corbett, Senator Monning. I'm Will Lightbourne, Director of the Department of Social Services, and as you noted, Deputy Director Bland and Child Care Program Bureau Chief Stan Cagle are also with us. A good starting place, I think, for us introducing this item is sort of reflecting back a moment on Dr. Cannon's presentation, where she spoke about the effect and the greater resulting impact on focusing certain resources on the most vulnerable low-income children. In many respects, our county human service agencies have a unique awareness of and connection to those very most high-risk, low-income families. As Mr. Woolsey observed in the LAO's overview of CalWORKS, those families that are participating and able to meet the participation requirements under either the state's first 24-month requirements and the later federal requirements are essentially guaranteed child care. So they really aren't the focus of what this proposal is about. This proposal, rather, is looking at those families who either have already slipped into sanction status, in which case they would not normally receive child care assistance and services, or as we deploy this new assessment tool over this coming year, those families where it is clear that there is sufficient instability that it's unlikely that they are going to successfully participate. And the goal then in these pilot efforts in up to 6 counties is to try to focus on those families with young children to get the children engaged in high quality care with developmental assets attached, and also provide the case support, the casework, to make it possible for the parent to successfully be part of that experience, to both be present in the child caring environment, as well as do other activities, either in parent learning environments of their own, in home-supported environments, or in other welfare to work activities as appropriate, so that their participation is starting to meet the expectations. The counties that would be proponents under this pilot proposal, we would be looking to them to identify how these activities would link with and lead to further engagement with welfare to work services. So, for example, what additional activity will be occurring in those first few months of engagement, and then as that period of engagement with the Parent-Child Engagement Project reaches what we're expecting to be sort of its natural point, what will they transition to? I mean, a good obvious example might be subsidized employment. Might be the next step in keeping someone who would otherwise have stayed in sanction status or gone to sanction, instead getting them on that path to full engagement. The child, of course, would remain in the development environment throughout the length of the pilot, and basically through the years in which age-wise they're appropriate for that. In the event that the parent was not able to maintain participation and it was not working for the parent, our proposal still is to retain the child in part day enriched care, so they don't lose as a result of something that they can't control. Again, our hope would be that the actual act of engagement is working on both ends of this. part of what we would be looking to our counties to do under the pilot is specifically work with those parents for whom as engagement begins, it's identified that there are other barriers, whether mental health, depression-related barriers, whether substance use disorder barriers, to help address those in that early phase of the engagement activity. As this is put together, I'd like us to think of CalWORKS as being a program that was always intended to be both for the benefit of adults and the benefit of children. Senator Waters used to say in this room, the K in CalWORKS is for kids. And that's something we always have to keep at the heart of the work that we're doing here. To the extent that this pilot would actually lead to successful engagement for the parent in welfare to work activity and movement towards self-sustaining engagement, and also succeed for the child in terms of the child having exactly the sorts of benefits and advantages Dr. Cannon was describing earlier, then that's a perfect outcome. If it benefits the child to some extent more than the parent, that's still a good outcome. And so the proposal before us is to start this with up to 6 pilot counties. We would start working with them with the expectation of starting the program in January 2015. And as you see in the summary, it would be a 3-year pilot with evaluation ongoing throughout. If it is proving to have the strength and the success we anticipate and we fully expect, then as we're moving it along, we would be working with our larger collectivity of counties to see what are the opportunities for expansion into other settings, how to sustain it in an ongoing basis, and if it is proving the sort of the valued investment we think it will be, then also be able to have ongoing dialogue with the administration and yourself around where we would go with this sort of effort. Again, just to summarize, I think for us the key point is saying, because we already know who is potentially at great need of these sorts of services, what we want to do is utilize that knowledge, that connection to those families, and the pre-existing sort of goals of the CalWORKS program, and build it out with this pilot to prove what we hope will be a very successful utilization for the most at-risk children in the community. So thank you. And Director Bland is here for questions or to elaborate.
And Director Lightburn, I just want to apologize for not recognizing you by name as we started. My apologies.
Not at all.
Thank you.
Thank you, Senators. Todd Bland, Deputy Director for the Welfare to Work Division at California Department of Social Services. Director Lightborn gave you a very good overview of the whole thing. I'll only add a couple things to that overview, and then we can dive into questions that you may have. Again, echoing back to Dr. Cannon's testimony earlier, she was mentioning the Chicago Child Parent Centers, which is indeed the model that we're building on, and now how it had those long-term impacts for children that are so beneficial. You know, better success in school, greater long-term achievement, and then less frequent involvement with the less pleasant parts of life, criminal justice system, and things like that. So again, we looked at the research as we were developing the proposal. Another point I'd like to make is, again, related to CalWORKS and how CalWORKS is welfare to work. We're targeting those families that are either in sanction or at risk of sanction. If you're in sanction, that means a reduction in the family's income. And I believe there have been presentations to this committee and to the Senate and in several settings about essentially how the negative impact of poverty, and especially deep poverty, on child development. So one of the goals of this, again, it's a multi-goal program in that we're going to be it's 2-generation. We're looking for the children and the parents. But if we can help the parents cure that sanction, and we really think we can do that because we're going to give them 10 to 12 hours in the classroom with their child, that will count towards their 20-hour requirement. And then we'll be able to build the rest with either some other supportive activity that they may need for barrier removal, or perhaps they're ready to move on to education or subsidized employment. When we cure that sanction, that brings income into the family. I think that's another benefit bit of the program that I wanted to call to your attention. So anyway, happy to go into questions.
Well, I do have an overarching question. In discussing the Parent-Child Engagement Pilot Project, I do know that some of my colleagues expected this to be rolled out as a program for all parts of the state. So I guess my first question would be, why are we selecting just a few counties? Obviously, this is a very important and intensive program that we've identified a need for, and we know we will have great results. Why are we limiting it to a pilot program at this time?
Frankly, I think we see it as a pilot program as a place to start and to try to tease out what works best so that assuming it's getting the results that we fully expect it to get, that as it expands, it's building on success. My own sort of perception of a large part of where we are in the human services field at this point is we have to be sure that we're being evidence and experience based so that the next dollar spent is always a wise dollar spent. And I think that what this gives us is a measured way to move it forward. And it could accelerate faster than suggested here, but at minimum it gives us a way to move it in conjunction with systematic evaluation on what aspects of the program really are working well. And if there are particular components that one county is doing that another isn't, that seem to be a variable affecting the effectiveness of engagement, we want to be sure that we have the time and the room and the space to move it out based on strength.
All right, thank you. Ryan Woolsey from the LAO is also part of this panel. If you would like to comment, please.
Thank you, Madam Chair. For our comments, we'd like to start by saying that we think the administration and Director Lightbourne has raised some really valid concerns about CalWORKs families with multiple barriers to employment, particularly when these families are sanctioned. As was mentioned, they receive reduced cash assistance, and indeed, the rate of sanction in the CalWORKs program is gradually increasing at this time. The proposal also raises some very important questions about the role of standards-based child care in the CalWORKs program. However, on balance, we recommend that the legislature reject the proposal for several reasons. This is a pilot project, and so we think it's important to think about what new information, what new approach the proposal would be testing that would add value to the program. The proposal is complex and includes different components of the intervention. It includes intensive case management and barrier removal services that is more geared towards the adults in the families. It includes stable, high-quality child care, which could help adults be work-ready and participate in CalWORKs, but is also probably more geared towards child outcomes, which would be probably longer term. It also includes parental involvement activities, which could be thought to assist both the adults and the children in the families. With respect to the intensive case management and barrier removal component, we think that the services proposed overlap to a significant extent with services that are available in the CalWORKs program, and in particular services that are becoming available through recent changes, most particularly the family stabilization component. In our view, many of these families that would be targeted by the pilot, sanctioned or otherwise, would qualify for family stabilization services because they would have those imminent, immediate needs that need to be addressed. So we're not sure that with that particular aspect of the pilot, there's something new that we would be testing of value. With respect to the child care, CalWORKs families, as has been mentioned, are provided child care currently in order to enable participation in welfare to work activities. And increasing the standards of that care may not help parents to participate in welfare to work more than otherwise would. However, we certainly would expect that increasing the standards of the care provided to the children could have some beneficial aspects. As has been mentioned, educationally focused programs, there's increasing evidence that they can have longer term impacts for children. But in terms of testing something new, the state already provides educationally focused programs through its Title V standards in the state preschool program. And in our recent report on restructuring the state's child care and development system, we noted that CalWORKs families generally do not access care in these standards-based settings. And we think this is a very important issue for the legislature to consider, not just for sanctioned CalWORKs families with multiple barriers to employment, but for all CalWORKs families in terms of the type of care that they can access. And we've provided several recommendations in our report on steps the legislature can take to that end, and we'll discuss those at a later point in the hearing. Finally, with respect to the parental involvement component, we are not sure that parental involvement will have much of an effect on the adult's ability to participate in welfare to work. There could be improvement for the child, and indeed, as has been mentioned, many of the most successful child development models include a parental involvement component. However, we don't think that this piece alone would justify a pilot in the CalWORKs program, which is a welfare to work program, given the pilot's cost. Thank you.
Thank you very much. I actually have a series of questions that we provided that have not been answered yet, so I'm going to go through them. So let's start with what are some of the barriers current CalWORKs families will face when selecting a child care program? And how do you believe this pilot project would address the barriers?